Welcome back to my chaotic life. So I'm on day 2 of round 14. Have my port, have my best friend that I towed around for 46 hours. I did get good news yesterday. Actually, 2 pieces of good news. So yesterday was my, I guess, bi-weekly appointment with my doctor, or bi-monthly. I don't know. I see her every other appointment. So my appointments are every 2 weeks, and I see her every other one. So this was my one with her, and we were supposed to go over all 3 of my scans. My 2 MRIs and my CT scan. Unfortunately, only one of my MRIs came back, and I did break my promises to my mom and Jeff, my husband. And I looked at the results pretty much as soon as they came in, and it was actually something good. So I have 4 spots on my liver. That's where the cancer went from my rectum and the tumor. So last time when I had the scans done back in February, there was no changes anywhere, which they said, we'll take that as a small win because it means it didn't spread. Hearing that there was no changes after 6 rounds of super intense chemo, where I felt like, especially the first 2 rounds, like it knocked the shit out of me. Like I was completely depleted, so much so I ended up having to take a 20-day break, and then I had 4 more rounds again of the extremely like intense chemo. And hearing that all of that was basically for nothing in my mind, because like even though it didn't spread, it's like, well, it didn't go away. Like what the fuck? It's supposed to go away. But hearing this, that 3 out of 4 of the spots shrank. The 1 spot decreased by half, which is incredible. The other 2 that decreased, it was a smaller amount, but it was still a decrease. And the 4th spot didn't decrease, but it's stable. So means it didn't grow. Unfortunately, for some odd reason, even though I got all 3 of the tests done in the same day, that was the only one that came back. So my doctor was extremely happy with the results of just the 1 MRI, but she wanted to be able to see the other MRI and the other CT and the CT scan. So she called radiation and was like trying to shake them down and be like, "Hello, we need these results. It's been 10 days at this point, 11 now." And normally, like the first MRI I got back within hours, and then the second round of testing that I got, it was like 3 days. And this, I got the first result at like the 7-day mark, and then nothing. So, my doctor has said that I will do 3 more rounds, possibly, of the downgraded chemo, because I've been having horrible neuropathy in my hands and feet, to the point where like my feet are constantly numb. I'm stumbling a lot when I walk because I can't feel my feet, and my fingertips from like this knuckle right here up is completely numb. So it makes my dexterity terrible. I have problems typing on my phone. Just my fine motor skills in general are not the best. So she wants me on a B complex vitamin to help with that. And then she also got rid of the oxaliplatin chemo in my chemo cocktail. And I am so thankful for that, because not only does that get rid of the neuropathy, but I will be able to have things that are cold. Like I will be able to drink cold water again. I haven't been able to drink cold water since I started chemo back in November. And I am a water drinker. Like that's predominantly what I do drink, but room temperature water is garbage. Like it's terrible. And I've been suffering this whole time, and like I really like iced coffee and iced tea, and I can't have anything iced. So when she was like, we can get rid of the oxaliplatin for the next couple of rounds, I didn't get it. It wasn't in this cocktail. And because that infusion bag takes 2 hours to like run through the drip. I was only in the chair yesterday for like an hour and 45 minutes, which was amazing because when I first started going, my first 2 rounds of chemo, I got in the chair at 9:30 and I didn't leave the chair until 3:30. So it's like it was a very long day and I did not feel good. Um, so I have my 5FU, that's what's in my bag. I get a push of that after my steroids, my pre-meds, and I have a push of an anti-nausea medicine, and then I get, it's like a chemo, but it's also, uh, I think a type of antibiotic. I'm not 100% sure. I think it's called leucovorin. I could be wrong on that. And I know I should know all this, but it's in my chart and it's written down, and I have a audio recording of all of it when she went over it in the beginning. But and then I just had the push of the 5FU, which I don't know, takes about like 5 minutes roughly because they have to do it slowly. And then that's what's in my pump with two anti-nausea medicines, I think. The steroids have me all sorts of wonky. I could not sleep last night at all, so I was up all night. And then probably around like 8:30 this morning, I finally got tired and I slept for like 2 hours. So it's just, steroids are wild, and I'll be so thankful when I don't have to take them anymore. So as of right now, I do have 3 more rounds of chemo scheduled, which I was hoping that I would be done. I was actually hoping I would get to skip this round of chemo because I've been feeling like such shit. And just my symptoms, my side effect symptoms have been shitty. But they are referring me to UPenn, to a GI surgeon, a GI specialist surgeon, because that is what will be my next course. They're going to see if the GI surgeon can, I don't know, can go in and like scoop out the cancer in my liver. But depending upon, because they're kind of far apart, so they might not be able to do that. It's all up in the air. The surgeon, Dr. Dulac, that I originally saw back in September, she is out on maternity leave until the end of August, so that's why I'm being referred to UPenn. And my radiation oncologist agreed with my chemo oncologist that that's the next best course, to see what they think. And then I'll either follow up with radiation and chemo or just chemo. Because the way she was talking yesterday, I'm probably going to be on chemo for the rest of my life, just because it traveled and that metastasized or metastatic, I don't know. It's pronounced both ways, but whatever. It just means it moved. It moved from my tumor to my liver and my lymph node. So it's in, I guess, my blood and my lymphatic system. So, yeah. But, so 2 rounds of good news that I'll be moving forward with the next step of my treatment, which means that I will get a break from chemo. So I'm very excited about that. And that, I might not have to do radiation, because that would be amazing. I don't want to have to do that because the side effects are horrific. But, yeah, so that's where I'm at right now.